So you mentioned that the clinical psychology course you did wasn't a doctorate, but you had to do a sort of an add-on bit in order to get your doctorate. Mm-hmm. And that's where your interest in the power dynamics in therapy comes in, it seems to me, because my understanding is that was the subject of your doctorate. And what was it that interested you in that? And still does interest you in that, obviously.
It does, yeah. Well, so I did the master's course first, and I had to do a thesis for that. And in that, my subject was how clinical psychologists dealt with lesbian clients. And so I interviewed a few lesbian clients, and I interviewed clinical psychologists about their attitudes and what they thought the issues were. And from both sides of this, the main issue that came up was the issue of power. I started to think, this is a much bigger thing than a particular minoritised group, and this is interesting. But I also was aware, so I'd always kind of been interested in power politically and personally, and at that time I was kind of reading things like Masson, and read Masson and thought, he's absolutely right, therapy is necessarily abusive, I've got to stop it now. But there was also part of me that was saying, I think he's missing something here, but I didn't know how to talk about it, and I didn't know how to spot how he was talking about power and what it meant. And I'd also realised that people talked about power meaning lots and lots of different things, but it was all called power.
Right.
And I think I kind of realised we were all really struggling from not having the language or the way to talk about it in a complex way. And then at the same time, when I failed my placements, remember, for not being empathic, my course suggested I went on an Introduction to Counselling Skills course, and they also told me that I should go and get my own therapy, because maybe there was some personal reason why I wasn't being empathic. So I was sent to therapy, and found a psychodynamic therapist at the time, and I've written about this in the Power book, in chapter 7, I think, in the old edition, chapter 8 in the new edition, but the psychodynamic chapter anyway. And my experience at that time of therapy in a psychodynamic framework was of the immense power in the transference interpretation, and I felt very powerless in that situation, and so that kind of led me to think, I want to understand what's happening here, I want to be able to talk about it. So this all kind of came together in thinking, okay, I'm going to theorise, look into all the theories of power and try and apply them to therapy.
Right. I mean, it's amazing that it seemed to me that the Dynamics of Power book, sort of, for a lot of people, was the first inkling that they had for a lot of practitioners, that power might be something of import. It sort of got little one-liners in other places. I know that there were some journal articles, but as far as the majority of counsellors in training in the UK, it seemed to come like a bolt out of the blue.
Right. And to me it kind of followed naturally from things like Masson and all the people that had kind of written critically about how abusive therapy was.
Sure.
And there had to be a counter to that if you were going to carry on doing it.
And in addition to the Dynamics of Power book, you also have edited books with Mary Beth Napier on feminism and therapy, with Mick Cooper, Beryl Malcolm and myself on politics. And as I think I said before, there's a bit of a theme developing here. I was wondering if there's anything that draws you to these political topics. Is it something that runs through your life, or is it just something that concerns you in therapy?
It's got to run through my life, really. I mean, whose life doesn't it run through, really? But
well, I would agree with you, wouldn't I?
Yeah. But I seem to just get broader and broader all the time the more I think about it. Which, I mean, it's always been an issue in my life, really. So my dad has cared for several neighbours who've been poorly, and my mum's always been involved in various bits of voluntary work. And that kind of idea of we're here to help each other has always been around, really. Then I went to university, and it was the ideal time, I guess, to go to university in terms of learning politics, because Thatcher was at the helm,
right? And
poll tax demonstrations, anti-apartheid, all that stuff. It was all left-wing politics everywhere, really, which was a great time to have a chance to be political in an activist way. And then at 22, the year that everything seemed to happen in my life, Just before I had a stroke, I got together with my first woman, so then discovered lesbian feminism, which I was completely oblivious to before this point. And I guess after that experience for the first time, really knowingly being oppressed. Of course, I must have done that before that as a woman, but I wasn't aware of it really. So that kind of got me interested in those kind of politics and queer politics and kind of just activism from that perspective really.
Right.
And then when I got into counselling and did the work at the crisis centre, all the politics within counselling, it all kind of came together really.
It seems so natural, the way you put it. That's because the trajectory you describe is one that's very similar to the one I went through, but probably not quite a decade earlier, or possibly a decade earlier, going on Bloody Sunday marches and university bringing things together for me in a way that meeting different people that I hadn't had that opportunity before, and it presented so many opportunities.
It's what university should be.
Well, exactly. Was it not left? Well, of course, I could make a statement about what university has become, but as you rightly say, what university should be. So that's interesting, and it's interesting that you brought it to bear on therapy. Then you started to recognise things, and that has continued. I've seen lots of things that you've written, and you mentioned earlier on the second edition of Dynamics of Power in Counselling and Psychotherapy is just about to be published, and I was amazed to realise that it's 15 years, and which then brought the question to me: what, in your view, if anything, it's a big if anything, has changed in the profession since the publication of that first edition 15 years ago? What's happened in counselling in the UK in 15 years? And the issue of the dynamics of power. Out and out.
I guess the thing I'm aware of that's a massive change is the fear and blame culture that I think has increased hugely during that time.
Right, yes.
Which has huge results on the practice of individual counsellors. I think there's much more fear about creative practice and much more fear about clients complaining. And complaints have gone up, but not hugely. You know, they're steadily rising, but it's still really unlikely.
And do you think, I mean, to interrupt, but it just you mentioned creative practice there, and I'm wondering whether you think a therapist who is interested in or more creative in their practice, is that therapist going to be more or less tuned in to the power relations, do you think, or is that a complete side issue?
How are they related? I would say that a therapist who's practicing from a place of fear and defence is more likely to perpetuate bad power relations.
Right.
Yeah, okay. So they're more likely to be kind of careful and doing things to cover their own back, not thinking about what's good for the client. You know, their fear's going to come over. They're not going to feel their own power from within. So the chance of the client getting any of that, I think, is really small. So the
fear and blame culture in the profession and in the practice of counselling, but also
in the world.
Yeah, the world.
Yeah. So I think that's quite a big thing, and has big impacts on power. And I think another thing that's related to that I've realised much more since the first edition, and hence changed the second edition accordingly, is how relevant the context that people practice in is. So I didn't refer to that specifically in the first edition at all, and kind of thought people could do that bit themselves. You know.
So give me some examples of what you mean there. I mean, I'm
so
intrigued.
IAPT is the obvious example that I've written about before in therapy today, and how much that context of practice affects how counsellors practice, how much it constrains what people can do, how much it focuses on measuring things that are really not relevant to the therapy relationship and distracts people from what really matters.
Yeah.
And how much that leaves counsellors without any power to either for themselves in their own workplace and so unvalued and therefore really not in a great place to have any power with their clients or encourage their clients' power
Mm.
and valuing. So hence a new chapter in the second edition about context, and particularly the example of IAPT.
Right.
That's increasing access to psychological therapy.
Yes. Yes. Right. I mean, I've got sort of a supplementary question there that's just come to me, really, seeing as I know that you were involved in the training of IAPT therapists until quite recently, and of course I've got dirtied my own hands with as far as IAPT is concerned.
Yeah.
And what I can say in my defence, I suppose, and it really does feel as though I have to defend it, that setting aside any theoretical and practical issues, the Counselling for Depression project really, it was an attempt to get humanistic therapy into IAPT, so that cognitive therapies didn't kind of just ride roughshod over everything. Whether or not it's been successful, of course, is a different thing altogether, and sort of out of my hands. But I do feel as though I have to defend that in some way. So did you? It's obvious that your experience then working as a trainer of IAPT therapists, that it had little or no impact, or unless you happen to be lucky enough to be a client of a therapist offering CFD, IAPT is still
IAPT's a big machine.
Gone wrong. It's gone bad.
Well, I mean, I left an IAPT service in 2013, so I'd worked in primary care and then IAPT for a long time before I then trained in it.
Right.
And it was a depressing place to work, you know, that got more and more and it was one of the better ones, I think, too.
Yeah.
You know, and as the IAPT machine became more and more focused on these numbers and clients being irrelevant and how to push everybody through the same conveyor belt, and the flexibility on it just got constrained more and more.
Right.
But I don't feel like I can defend training counsellors to work with an IAPT, because I think politically it's really important that humanistic counselling is offered within the NHS and free at the point of access. What I think's harder to defend is, well, it's not me to defend it, I guess, but I feel for the counsellors working in that system. I think the price that this individual staff pay to do that, to try and provide that service ethically, especially in services where CFD practitioners are on their own, or there's very few of them and they're heavily CBT dominated, which is most of them, but not all. I think it's really hard. You know, I think the language that's talked within those services about clients is completely alienating and not valuing of either the staff or the clients. And I think to hold your own, look after yourself and be able to provide anything like a humanistic environment with clients is really hard. I think there's some hope for the places that have got a critical mass of CFD practitioners who can meet together and speak a different language, and you know, and have more opportunities for self-care, and have managers who understand that way of working and support it. And who knows what will happen.
Yes, well, I mean, the only problem with that is that those places seem few and far between, as far as I can see. And maybe it's time for professional organisations to provide support for CFD counsellors within IAPT, so they don't feel so isolated. Well, on that not altogether positive note, but at least it is the way things are going at the moment. So thanks very much, Gillian, and good luck with the second edition.
Thank you.